Hi everyone, in this video we will be learning about the HIV virus and AIDS. Before we begin, let's take a short quiz to see how much you might already know or have heard about HIV/AIDS. There are some statements that you may have heard that are not true. In this video, we hope to clear up any false statements. You can write your answers to the questions on the quiz included in your folder. Question 1. HIV is the virus that causes AIDS. True or false? Question 2. HIV attacks the body's A. Immune system, B. Digestive system, C. Respiratory system, or D. Brain. Question 3. Who can get HIV? A. Adult men only, B. Adult women only, C. Kids and teens, or D. Anyone. Question 4. If someone has a family member with HIV or AIDS, that means that they will have it too. True or false? Question 5. While people can be treated for HIV/AIDS, there is no known cure. True or false? Now, let's go over the answers. Number 1, the answer is true. HIV is the virus that causes AIDS, and we'll talk a little bit more about this later. 2, the answer is A. HIV affects the immune system. 3, the answer is D. Anyone can get HIV. 4, the answer is false. Just because someone has a family member with HIV, that does not mean that they will get it. And the answer to question 5 is true. There is no known cure for HIV/AIDS, although there are now some treatments that are helping those with HIV to live healthier lives. So now that we've taken that short quiz, you're probably wondering, what does HIV stand for? HIV stands for Human Immunodeficiency Virus. HIV is a virus that attacks a person's immune system, like we learned earlier from the quiz. The immune system's job is to fight off germs and bacteria and viruses that can make you sick. People with HIV have weaker immune system that make it difficult for their body to fight off colds and other illnesses, even cancer. Eventually, the HIV virus in a person can turn into AIDS. AIDS stands for Acquired Immune Deficiency Syndrome. A person with AIDS will have a weak immune system and cannot fight off many deadly diseases. These are sometimes called opportunistic diseases, meaning they take advantage of the weak immune system. It gives them the opportunity to make a person sick. A person with a healthy immune system may be able to fight off these diseases better and stay healthy. So, how does a person get the HIV virus? The HIV virus is passed through the exchange of intimate bodily fluids. We'll talk more about what these are in the next slide. For now, it is important to understand that the HIV virus is not passed through saliva, spit, urine or pee, sweat, or through the air, like in a cough or a sneeze. There are 3 main ways that a person can contract or get the HIV virus. The HIV virus can be passed from one person to another by having genital contact or having sex with an infected person. Genital contact refers to a person's privates, penis or vagina. Another way HIV can be passed is by sharing a needle with an infected person for drug use. People in the medical field, like nurses and doctors, also have to be very careful when using needles for medical procedures with an infected person. A third way that HIV can be passed is from a mother to a baby through breastfeeding. Meet Cami. Here's a link to a 1-minute video that talks about ways HIV is not spread. Take a second to watch this with your class.
Welcome back.
Some people might wonder if they have HIV virus because they might have experienced the things that put a person at risk, having sex or sharing a needle for drug use. Many people with the HIV virus do not have symptoms, so the only way to know if a person has the HIV virus, called HIV positive, would be to get tested. An HIV test is done through a blood or urine test. They won't have to wait long to find out whether or not they are HIV positive, since we now have very quick test results. Thanks for watching this short video, and we hope that you stay healthy and make smart choices. See you next time.